Thank you for joining us for the 7th edition of the Quick Hit video series presented by Eaton Wiring Devices. Be sure to click on the subscribe button to be notified of more videos as they become available. Today we're going to talk about Hart Healthcare Solutions. Let's begin by saying that healthcare facilities are highly specialized and have many unique requirements. Medical professionals depend on reliable connectivity as they care for their patients in a variety of situations. In fact, the National Electrical Code contains an extensive article dedicated to the special requirements of these facilities. Furthermore, UL 498 has a special battery of tests and design requirements for plugs and receptacles intended for use in hospital patient care spaces. Hospital-grade devices are identified by a green dot, such as the one located on the face of this duplex receptacle. So, how does a device get the green dot? Here's a summary of the additional testing required for a wiring device to be listed as hospital grade. Let's take a closer look at one of the tests for receptacles. The procedure is rather lengthy, but it basically includes a series of steps to break in the contacts and then yank out a test plug at an angle using a 10-pound weight dropped from 24 inches. The receptacle must endure this extreme action a total of 8 times, remain undamaged, and maintain a minimum plug and ground pin retention force. Now let's take a look at the full range of Hart devices commonly used in healthcare facilities. Beginning with the hospital-grade devices, we have 2 classes of receptacles, heavy-duty and extra heavy-duty. Both pass all the tests required to get the green dot, but the extra heavy-duty design has additional features to enhance long-term reliability. We've already covered the plug retention benefits of the 5-leaf contacts in a previous video. Additionally, these receptacles have a glass-filled nylon base for extra strength and heat resistance. Plus, they have these guards to insulate the terminals, circumventing the need to wrap the device with a couple layers of electrical tape before mounting it in a metal box. It has a one-piece mounting strap with an integral ground contact to ensure the most reliable ground connection. It's important to note that reliable grounding is a critical concern in hospital design and construction. Finally, all the hardware is either nickel-plated brass or stainless steel for corrosion resistance. Before we move on, let's note 3 important code requirements for hospitals. First, the color red is used to identify which devices are connected to the emergency electrical system. The code requires such devices to have a distinctive color, and red is normally used for this purpose. Secondly, the number of receptacles in certain areas has increased dramatically during the past few years to serve a growing number of specialized medical equipment. Today, there must be at least 8 per bed in patient rooms, 14 per ICU bed, and 36 in each operating room. And third, receptacles in areas where children might be present must be listed as tamper-resistant. This includes not only the pediatric unit in a hospital, but also most common areas in any medical or dental facility. Other hospital-grade devices include special purpose receptacles, plus a variety of plugs and connectors. Here's an interesting note. Some hospital-grade plugs and connectors have a transparent housing. This allows for a visual confirmation that the wires are connected securely and correctly, which is a popular preference for hospital maintenance staff. Here's an overview of several other devices that are commonly used in a healthcare facility. All of the lighting controls have a 120-277 volt rating to accommodate light fixtures using the higher voltage. These power lock devices are sometimes used with portable X-ray equipment. Their unique design provides a very reliable connection. In conclusion, wiring devices used in a healthcare facility must endure the rigors of this challenging environment while maintaining the highest degree of reliability. Hart meets this challenge because we understand that in healthcare, it's all mission critical. Thanks again for joining us. If you're in the Gulf region and want to learn more about these or any of our other products, please contact our agent in your area. There's also a link to each agent website in the section below this video window.